Hello, I'm Kay Tran, registered dietitian from the Clinic for Motor Neuron Disease. We're here today to talk about alternate options for feeding. Many people wonder when is the right time to consider an alternate means of feeding. And there are some key indicators that can help you make your decision. The first and most obvious one is significant weight loss. Staying well nourished can help the individual feel healthier and stronger. Oftentimes, swallowing safely becomes a concern. You would know this by symptoms such as coughing, choking, and aspiration. Eating oftentimes requires increased effort and significant amounts of time in order to eat enough to meet your nutritional needs. There can be increased stress around food issues for the individual and caregivers. And finally, hand and arm weakness can make it difficult to bring food to one's mouth. What is a feeding tube? The most common procedure is endoscopy performed by a gastroenterologist using a flexible scope while the individual is sedated. It is called a PEG and allows nourishment to enter the stomach directly. A common question is, can I still eat if I have a feeding tube? The feeding tube does not prevent eating and drinking by mouth. The feeding tube is just a tool, and it does not need to be used all the time. The individual can participate in family meals and enjoy bites and sips. How do I use the feeding tube? Usually it's 3 times a day, just like meal times. 1 to 2 8-ounce cartons of formula are delivered at each feeding, and a feeding takes about 20 minutes. You want to go slowly. To meet fluid needs, one can give additional water if drinking liquids is a challenge by mouth. If the tube has not been used for feeding, then the recommendation is to flush with 2 ounces of water 3 times a day for hygiene. The good news about a feeding tube is it can relieve stress to the individual and the families. The individual may have more energy from better nutrition and may feel less tired from the efforts of eating. There is reassurance that optimum nutrition is being achieved for health and well-being, and the pressure to eat enough is no longer there. So many individuals and families feel relieved. If you have reluctance or hesitation to consider a feeding tube, that is not uncommon. I have confidence when you make this choice, you will not regret it. Thank you for listening.